Insomnia is a sleeping disorder characterized by difficulty in falling and or staying asleep, and is experienced by 10 to 20% of the adult population, with 50% of those cases being chronic and induced by stress. Insomnia that is induced by stress is caused by an overabundance of the stress hormone, cortisol, in the body. In the modern world, stress-induced insomnia is a very common disorder triggered by highly intense lifestyles, most clearly evident in young adults and adults, specifically females. In the 61 years since melatonin has been distributed as a pharmaceutical for insomnia, no distributor has been able to successfully find a treatment for stress-induced insomnia, that is, until now. Azamantadine is the first ever pharmaceutical treatment that aims to treat stress-induced insomnia by decreasing the exorbitant amount of cortisol present in the body, thus reducing physiological stress. Azamantadine is able to do this because of a slightly modified active pharmaceutical ingredient, AZD4117, which is an antagonist that inhibits the liver enzyme 11-ketoreductase and disrupts it from converting the inactive compound cortisone to the stress hormone cortisol. Before discussing how to improve azamantadine is made, information about the original active ingredient must be explained. AZD4117 must be able to reach the liver and allow it to interact with the enzyme to work efficiently. Therefore, formulating the drug as a topical cream for the skin surface will not suffice. Other routes of administration that could be considered for AZD4117 are mucosal, intravenous, and inhalation. However, these routes are too fast for the ideal transportation of the drug. Therefore, AZD4117 must be an oral medication, either a tablet or a capsule, to ensure that it passes through the GI tract in order to reach the liver and ensure the active ingredient is released from the tablet at a controlled rate. As a result, the route of administration must be done orally. Tablets are the most prominent dosage form of the drug. However, capsules are also considered a potential route. Whilst both capsules and tablets are very similar, the difference lies in the manufacturing of these medications. Unlike tablets, capsules are generally made from soft or hard gelatin that coats the active ingredient. Unfortunately, soft gel capsules are quite susceptible to moisture, which is unwanted, as the active ingredient AZD4117 contains a thioether, a sulfur-containing functional group which is prone to oxidation. In a moisture-rich environment, the likelihood of wet oxidation would increase, which would therefore break down the drug. On a similar note, hard gel capsules are also vulnerable to moisture, as they contain about 13 to 16% moisture, which despite being low, can still be a risk for the sulfur group. Therefore, a tablet is the best dosage form for this drug. Now the dosage amount of AZD4117 can be addressed. Currently, the dosages provided to patients were 750 mg twice a day, or 750 mg followed by 75 mg every day up to 900 mg twice a day. However, these dosages were for immediate release tablets only. From these dose trials, it was determined that formulating a diffusion controlled release tablet would be the most appropriate for AZD4117, as this would mean an individual would only have to take one tablet a day for the effects to be prolonged. A diffusion controlled release tablet essentially involves the diffusion of an active ingredient through polymer membranes, and the systems by which this can occur are through matrix systems and reservoir systems. Matrix systems are used when some of the API needs to be released immediately and the rest gradually, whereas reservoir systems are used simply for controlled release over a period of time. A reservoir system will be used for AZD4117. The dose would still be 750 mg, yet it would be taken only once a day until change in sleeping behavior was noticed. For example, until an individual was able to fall asleep within 30 minutes of attempting to, or for a week, whichever comes first. If no changes are observed, increase the dosage to 2 tablets and continue the dosage until the individual is able to fall asleep within 30 minutes of attempting to. The properties of the active ingredient are also supportive of the idea that AZD4117 is ideal for its intended pharmacological functions. The physiochemical properties of the original active ingredient demonstrated that AZD4117 does not violate any of the Lipinski's rules of drug-likeness, and hence it is denoted as being drug-like. Its partition coefficient value of 3.16 suggests that the drug is sufficiently lipophilic enough to permeate through the specific plasma membrane barriers. The TPSA value of 107.83 square angstroms implies that its polarity is sufficient enough for the drug to be dissolved in aqueous environments. The molecular weight of 419.58 grams per mole is informative of the fact that the drug is of a satisfactory enough size that it can pass through plasma membranes. Finally, the 6 hydrogen bond acceptors, 2 hydrogen bond donors, and 9 rotatable bonds all demonstrate AZD4117 has the ability to make many interactions with the enzyme that ensure for a strong ligand receptor binding complex that efficiently suppresses cortisone conversion to cortisol. However, the efficiency of AZD4117 can still be improved. Replacing the cyclohexane ring with the adamantyl group showed a greater lipophilicity of the drug, as shown by a high log p-value of 4.11, due to the fact that adamantyl groups are known for providing great potency with their binding site, due to the ability to form strong bonds with the hydrophobic pocket found next to the cofactor of the enzyme. Whilst the addition of the adamantyl group did not change TPSA or the number of hydrogen bond donors and rotatable bonds, other alterations such as the increased molecular weight of 471.66 grams per mole does not interfere with the compound's ability to act as a drug, as it is still of an adequate size to permeate plasma membranes.
Before the drug can reach the drug target to inhibit the enzyme 11-ketoreductase, it first needs to reach the liver without being metabolized by the body. Therefore, to enhance the ability of azamatodine to reach the acquired drug target, a series of excipients are added when formulating the pharmaceutical drug. The excipients are as follows: diffusion-controlled release, hydroxypropylcellulose polymer at concentrations of 15 to 35% are used to control the release rate of the active ingredient AZD4017. This water-soluble polymer is a thin film that surrounds the active ingredient. Furthermore, a hydrophobic compound such as delta tocopherol at a concentration of 0.01 to 0.02% weight per weight can be used to protect the sulfur group of AZD4017 from being oxidized, as it is an effective antioxidant and is the most potent antioxidants out of alpha, beta, and gamma tocopherols. Diffusion control release. Ethyl cellulose polymer at a concentrations of 10% is water-soluble polymer that constitutes the outermost coating of the tablet, that functions to enhance the controlled release rate of the active ingredient by increasing the porosity of the membrane and enhancing the extent of diffusion of the active ingredient into the liver. Binder. Alginic acid used in tablets as a binder at concentrations of 1 to 5% weight per weight. It is a polymer. Binders are necessary as they provide mechanical strength. Lubricant. Magnesium stearate used in tablet manufacturing at concentrations between 0.25% and 5% weight per weight. This is necessary to ensure that the formulation and ejection of the tablet during the manufacturing process occurs sufficiently to reduce any risk of compromised tablet quality. Solution enhancer. Prospovidone is used as a dissolution enhancer at concentrations of 2.5 to 5% in tablets prepared by dry granulation. Simultaneously, it can also work as a solubility enhancer. Flavoring agent, ethyl vanillin, at concentrations of 0.002 to 0.025%, is used as a flavoring agent to remove the poor taste of the tablet caused by the presence of sulfur. Now that the active ingredient and the necessary excipients are known and have been established, the drug needs to be manufactured into a tablet. Manufacturing. Tablets are generally manufactured using 3 main processes. They are wet granulation, dry granulation, and direct compression. In the case of azamatodine, the dry granulation is the best method of formulation, as it is the best process used for products that are sensitive to moisture. This is crucial as the active ingredient AZD4017 contains a thioether, a sulfur-containing functional group which is prone to oxidation. In the moisture-rich environment, the likelihood of wet oxidations is increased. Therefore, using the dry granulation methods will produce the best results. The process of dry granulation can be summarized into 5 steps. First, the drugs and excipients are milled and mixed. Then they are compressed into slugs or they are rolled compact. The slugs and compact powder is then milled and screened, mixed with lubricant, and finally compressed into a tablet and ready to be packaged. Due to azamatodine containing an active pharmaceutical ingredient that is both light and moisture sensitive, the tablet cannot be packaged into a sachet, bottle, or vial, as this would increase the risk of tablet degradation. Therefore, the primary packaging options include blister packs and strip packs. The difference between strip and blister packs is that strip packs are covered with aluminum foil on both the inside and outside of the pack, whereas the blister packs have only one side covered by aluminum and the other covered by plastic. The plastic covering could also pose a potential risk of tablet degradation. Therefore, the most appropriate packaging type and the one that will be used is strip packaging. A further advantage for consumers is that they are able to easily track how many tablets they have taken. Now that packaging and manufacturing have been discussed, it is important to ensure that the tablet is suitable for distribution, and this can be done through a series of analytical tests that must be conducted. These tests include determining the uniformity of the drug, which can be done by collecting a batch of tablets and determining the amount of AZD4017 in each tablet. The solution test, which determines the increasing amount of drug that passes into the solution over time, allowing for the determination of how long the tablets will take to release the active pharmaceutical ingredient. Mechanical strength tests such as attrition and the fracture resistance are conducted to determine the strength of the tablets. Attrition tests involve weighing tablets and then rotating tablets into cylinder and noting down if weight loss occurs after a given number of rotations. In summary, over the many years since medication was made to treat insomnia, finally a medicine has arrived that aims to treat insomnia induced by stress, a disorder very prevalent in the modern world. Designed by improvement of a pre-existing drug, azametodine will be able to successfully treat stress-induced insomnia in both young adults and adults at a dose of only 750 mg once a day. Patients no longer have to wait for the better days of the future, trying to coordinate and rely on long therapy sessions alone to rid their sleepless nights. The answer to the problem is here and available for only $30. Azametodine, the first ever pharmaceutical drug that will successfully treat stress-induced insomnia.